Hi, I'm Vivian Rain with Dr. Bizboom. On this video, I'm going to be discussing the difference between the tone in the delivery on the part 1 and the part 2. During the part 1, you're doing the introduction and eliminating factors in exam, and during part 2, you're doing the ROF, right? And we call these part 1 and part 2 for a reason, because there are two parts to the whole cycle here. Ideally, they should be done in one day, okay? So I want to talk about the difference though. Now in the part 1, what are we doing here? In the part 1, we're going to have the tone and be communicating that we're going to see if they have neuropathy, if it's a type of neuropathy that we treat, and if it's at a stage where we can still help them. That's what we're looking to determine, right? And it's very business and it's very matter of fact. We're going to see. We're going to see if we can help you. We're going to see if you have neuropathy. We're going to see if it's at a stage that we can accept, right? This is the push away of the acceptance portion at this stage in the game, right? It's serious in tone, but it's more, let's see. Let's see what you have going on here, right? Now, after we determine during the exam that they do have neuropathy and they are in the right place and they don't have anything that bars them from being a candidate for our treatment, now the tone is shifting. The tone is shifting to, in the transition between part 1 to part 2, that there's concern. They show signs of significant nerve damage and we're concerned. And we need to do some work on this to see if we can accept them and see what's going on here. And we need to get them to the part 2 right away. That's the shift in the middle. So you see how it transitions from let's see what's going on here, see if you're someone we can help, to the concern. Now in the part 2, it shifts totally to massive concern. This is very serious and we need to see if we can accept you into care. Now that's more than just, do you have neuropathy? There are criteria for people you accept into your clinic, and if they're not, there should be. It's not for everyone. You need somebody who's making this their top priority. You need somebody who's going to successfully complete your treatment program because results are important and you know this program works, and you protect your results, and you do so by not letting people into your program who aren't going to do what's needed to get the results, right? So you have to qualify to be accepted into treatment, into your practice. And that needs to be the attitude, and that needs to be the criteria. That needs to be the standard, right? They need to be accepted into your clinic for basically understanding the importance, making it their top priority, and doing their part to make sure that the treatment is successful. That needs to be the tone, right? It needs to be a push away. Let's see if we can accept you. And this is who we accept. And if you push back and you're asking me, well, how do I know this is going to get worse? Then that needs to be a moment where you actually pull back and go, I'm not the one who says it gets worse. The National Institute of Health is the one who says it gets worse. What do you think? Because if you don't know that, then I haven't done my job very well. But we don't accept anybody who doesn't understand what happens here. Otherwise, they won't put the correct amount of importance on this. So I just wanted to explain the difference in greeting them in the day 1. Let's see what you have going on. Let's see if you have neuropathy. Let's see if it's at a type we can treat, at a stage we can accept you, to the concern, right? Now, I do want to mention, I have something that is completely unacceptable in my clinics and should be in yours, and that is treating somebody differently because they have only hypersensitivity or 8s, 9s on their, and some 10s on their scores, meaning early stage neuropathy. You do a massive disservice to somebody if you treat them any different than somebody who has 3s and 4s and 5s on their scores. Because if you don't think it's serious, they're not going to think it's serious, and it is serious. Because what happens if they don't do something now is they become somebody who has 0s, 1s, 2s, and 3s, and they have this one opportunity and chance to sit in front of you to do something about it, and if they don't, their prognosis is grim. They will get worse over time, and their likelihood of a fantastic result is best now, not then, not when they wait for it to get worse. So don't you dare treat scores that are the initial stages of neuropathy with any difference in tone or seriousness regarding the discussion about their condition. This patient needs to do something now, and if you don't get that, then you have a misunderstanding about neuropathy. But you best communicate with a seriousness and concern just as much for that patient as you would somebody who has, significant severe neuropathy, because that's where they're headed, and this is their opportunity to do something about it, and this is their opportunity to do something about it and have the best chance at the best result. So that's the difference between the part 1 to part 2, and kind of a little difference in the tone and what we're doing by way of qualification and push away. Those are important things in this cycle. The scarcity, them being accepted, they need to meet certain criteria to be accepted. These are the things that should be constant in your guys' cycles and the tone that should exist in all of these portions, all right? I hope this has helped you understand that a little bit clearer and get down your distinction between the tone and the communication in a part 1 versus a part 2. And go review your scripts and do great by your patients. Thanks so much. Bye-bye.